So, as a summary, what is the type of problems that can happen with an implant? And now we are speaking mostly about problems that can occur during periods after the placement, not during the placement, but after.
Okay, in this case we are talking like a post-operatory inconvenience. So the most post-operatory inconvenience that is we can see most is the periimplantitis. And periimplantitis means that when the patient has a loss of bone or has some kind of inflammation in the gingiva and has bleeding. That means periimplantitis.
So periimplantitis, what is that really?
Really is when, for example, a normal patient can see when he's just brushing his or her teeth, they see like a bleeding that they come from the implant, from the gingiva, and said, why I have a bleeding? Or sometimes they have a bad smell, or sometimes when they see the implant, they see some kind of metal structures, and they said, what happened here? This is how the first symptoms that the patient can see. So, in conclusion, periimplantitis is an infection of the gingiva and the bone that the result will be that the implant is failed.
So if you allow this to exist and it will develop, then it can be a potential big problem for the implant.
Yes, absolutely. It's, what can I say? If you see, for example, in each treatment that we make, always is going to be something that it could be bad or it could be well. But if you still with good hygiene, you go with your checkups and make the things right, all can be better. What happened with the periimplantitis? Again, right now, the implant has no nerve, so you don't feel pain. You don't feel pain. That's one of the first reasons that the patient doesn't come to us. Because, no, I don't feel pain. It's not like a tooth. When a tooth is bleeding, when the tooth is like a moving, you feel pain. But in the implants, it doesn't happen because we don't have a nerve inside, because it's a titanium screw. So that's why I recommend to the patient when they feel that it's bleeding, that they have some kind of inflammation in the gingiva, come with us and we can try to keep the implant as long as possible.